Well, hello, I'm State Senator Roxanne Persaud, representing the 19th Senate District, a district that covers parts of Brooklyn and parts of Queens. I'm not going to go into every geographic location for the district, but it's a fabulous district. And today we are speaking about diapers. Why are we speaking about diapers? We've been doing this for a number of years, and I have two guests here who will be talking with us about the need to fund diapers and why. And they will also tell you about what they do and why they do it and what got them to the space where they are. So my first guest is Lacey Gero. She's the Chief of Government Relations, National Diaper Bank Network, and Alliance for Period Supplies. Welcome, Lacey. And Raziya Hill, founder and executive director of Every Bottom Covered. Don't you just love that name? Every Bottom Covered. What does that mean? Every child must have a diaper on. Every bottom covered. So I'm going to start with Lacey. Lacey, can you introduce yourself and tell us, what we need to know?
Yes, thank you so much, Senator. So I'm Lacey Gero. I'm the Chief of Government Relations at the National Diaper Bank Network. And the National Diaper Bank Network leads a nationwide movement to ensure that families, individuals, and children have access to the basic necessities that they need to thrive. This includes clean, dry diapers, period supplies, as well as adult incontinence products. So our work is to ensure that families have everything that they need, but we do that through three things. One is research, making sure that we understand what the need is across the country. Two is through advocacy and working with state governments as well as the federal government to ensure that there's policies that support families in accessing this. And then we work with diaper banks who are doing the work on the ground to ensure that families have access to diapers. And so I get to work with Raziya in New York State. We work with 17 other diaper banks as well who are members of the National Diaper Bank Network.
Thank you. And Raziya, tell us about you and tell us how did you get to the space where you have every bottom covered?
Well, thank you. Thank you for having me, especially. So I started this work from my own lived experience as a mother experiencing diaper need myself when my child was a baby, and recognizing that here in New York State or in Buffalo and West New York particularly, there was no resource like this available for families to get that support. And so just doing some research and linking with National Diaper Bank Network, we have been able to not only educate ourselves, but educate the Western New York community and to be able to address those needs that Lacey brought up around adult incontinence, around diapering and period poverty.
Well, thank you both for the work that you do. A few years ago, like 10 years now, since I've been advocating for diapers for families across the state of New York. And how did I get to this point? It's because someone actually came to me and said, do you know that there are people who can't afford diapers? Do you know that there are families who the kid is sitting in a soiled diaper all day long? They can't, they can't afford it. And I'm like, what are you talking about? This is a wealthy state, right? That can't happen. The same as you talked about period poverty. That can't happen. Not in New York. And then we found out, yes, kids cannot go to a daycare center because the parents have no diapers to send them to a daycare center. And then they're home and one soiled diaper, they're in it all day. They end up with a rash. Now we end up paying for health care because they end up, with an infection. They're going to the hospital or all of these things. And we're like, can't be. And then someone says, in Canada, they give free diapers. I'm like, please, no way. And then we started doing our research. And then we got to know the National Diaper Bank. And so I want Lacey to tell us, what do diaper banks do?
So diaper banks, they serve their communities with diapers, and why they exist is because currently the federal government doesn't have an assistance program. As you mentioned, in Canada, we aren't giving diapers to families for free, and there's also not support for that. And so programs like SNAP and WIC don't include diapers, and that makes sense because they're food-based nutrition programs, but we don't have that equivalent support for diapers. And so there's this gap, and that's why diaper banks became so important. And so As you mentioned, a lot of families that need diapers, what happens is their child can't go to childcare because childcare facilities require that you bring a week's worth of diapers with you for your child to go to childcare. So a lot of times people ask, well, what about cloth diapers? Well, you can't bring those to childcare, which means that parents can't go to work. And so diaper banks work to fill that gap that families face. And the amount of diapers that they typically give is that amount that's needed for children to go to daycare so parents can keep going to work. And so the work of diaper banks is so important because we're ensuring that everyone has the economic opportunities to get them out of diaper insecurity.
Interesting. So since 2018, you've been working with me on my legislation where I've been advocating for, the quarterly allowance to assist these families, and it's been tough getting it across the board. And this year we've reintroduced the legislation again, hoping that we can get it and that people will realize the need for that. I have worked with Assemblymember Szalages on this because we understand the importance of making sure families have the assistance that they need. There are some people who think that us offering to give diapers to families, that we're just giving them a handout. Why should we give them diapers? So, Raziya, can you tell us the importance of helping these families?
Absolutely. I mean, just from a perspective of no matter what side you sit on, we know that babies genuinely are nonpartisan and they are not concerned about our political affiliations. They have a need to stay clean and healthy. And I've not met a community that can't benefit from clean and healthy children. It is important to note that we do work in rural communities, and four of our 6 counties are rural, and the need there is so great. We're not even touching the amount of need as if we were across the entirety of the county because there's so many other things at play, like the digital divide, transportation concerns and issues, lack of workforce in those counties. And those are things that we don't think about, I think, I don't want to overly politicize it, but when we go and we make these choices on election day, we don't think about what it's going to mean the day after, and what led up to election day when we're making those decisions. And sometimes we're not putting the interest of community in the proper view, or we're putting these type of guardrails on it that makes it appear as if only one population benefits the most. But we serve just as many people in rural populations as we do in urban populations, if not more. And so I think that begs the idea that we should probably take our personal feelings off of it and think truly about making safe and healthy households, because that's how you keep people productive. That's how they continue to thrive and to grow inside of our communities, and that's how they continue to make the communities healthier and better.
Right. That's right. So our legislation is modeled off of California's legislation. And Lacey, do you want to talk about legislation at all? California's done it.
Yeah,
And
absolutely.
people tend to look towards New York and California and say, oh, what are they doing? But California has done it. Why can't we do it in New York?
Right. And so California is providing a stipend monthly for families to be able to receive $30 extra a month through their TANF benefit to be used directly on diapers. And while that's not going to fully cover the amount that they need for diapers every month, that really does help to fill, again, that gap. And so, in addition to California, Washington State has provided the stipend, and New Jersey has now provided the stipend. And so, we're really hopeful that New York will be the next state to do this. Also, some interesting policies that we've seen across the country over the past few years is Medicaid coverage of diapers has become a big issue. And so, in Tennessee and in Delaware, there's 2 pilots happening where they're covering diapers under Medicaid. And so families that are enrolled in their Medicaid programs are receiving diapers for free. And in Tennessee, that's happening for children 2 and under. And in Delaware, it's happening in the first 12 weeks postpartum, which we know is a very important period of time for a mom and a baby.
Well, if Tennessee could do it, why can't New York do it? That's all I'm saying. I'm going to read some stats here that I have, that states that offer fixed guaranteed diaper allowances to parents of newborn, other than California. So you talked about Tennessee. Yes, they are offering, guaranteed, and they started that in 2024. Delaware, yes, New Jersey, Washington. Then we have Illinois, Massachusetts, Indiana. Indiana is using the TANF funding to do it. Massachusetts, they did that 2024, and they're granting a one-time diaper allowance to eligible recipients for children under the age of 3. That's similar to what my legislation was doing. So granted, actually, we said 2 years old, and then a former senator said to me, I know she has many kids, and she has grandkids. She says, we needed to go to 3 years old, right? Do either of you want to touch on why we should cover diapers until the age of 3?
Well, I yield to Lacey as well. But at the 3rd birthday, Medicaid will actually take on the support of incontinence supplies for children who are at that 3rd birthday. And so you're literally leaving no gap there should there be some concerns about developmental delays with children. I think it is just a really great way to have that continuum of care for families. And it also, for me, as I relay it to families that we serve, it also shows families how to advocate for themselves and to do other things like age and stage questionnaires to make sure that the child is developing on time and on target, so that it'll make them talk to their doctors more, because your doctors are able to give you the prescription. It's a very, I won't say an easy process, but it's a process that if you're documenting properly concerns about incontinence with your child, by the time the 3rd birthday comes around and our services end or that particular benefit ends, then families know that starting from there, they'll be able to get that governmental Medicaid support. So to the point that you're making, I think we just really have to normalize either raising these benefits based on cost of living that is increasing and our expenses are continuously going up, but then the benefits that help underserved or under-resourced families are not being scaled to in the same way. Or we need to really allow our families to start to use their voice and help us advocate and legislate alongside you, because it's going to be important that they're telling what this $100 or $200 or whatever the amount is, how much more it can do in their household.
That's true. You want to continue on that, Lee?
Yeah, and just to second that, I think also that age 3 is so important, because when we go back to, where we sort of started this conversation about children being able to go to daycare, they're still going to be going to childcare through age 3. And so we don't want to leave a gap there where, parents could have diapers and then all of a sudden they don't. And then that's interrupting their work schedule and their opportunities.
Interesting. I never thought of that. The continuation of the supplies. We tend to, when in government, we look at, oh my gosh, how much is this costing us? Right? And in the social services arena, people think that the first thing they look to cut when there's a funding challenge is things within social services. And so there are people who see this as not as a priority, right? Right now, we have the federal government looking to cut our SNAP funding and other things. And so when you talk about giving a family diapers, people are like, there's no need to do that. We have things that are higher on our list of priorities. But it's not so. Making sure every bottom covered is really covered should be a priority for us, right? So both of you, and others were here when we were doing the press conference asking for funding for diaper banks. Lacey, do you want to talk about what we're asking for and why is it important that every year we fund diaper banks?
Yeah, so for this year, we're asking for $2.5 million for 18 diaper banks across the state. And this is so important because what we know is that the dollars that are invested into diaper banks, we see a return on those investment through medical savings, through decreased visits to, emergency rooms, but also through the wages that families can have and spend on other essentials or other goods and return back into the economy. And so when we think about investing in diaper banks, we're also investing in the state economy, individual economy, but we're also just making sure that everybody has what they need to thrive. And one of the things I think we haven't talked about is just the impact of diaper need on a parent's stress, their worry, their anxiety. And so in addition to the health concerns that we have for babies who might not have the diapers that they need and have diaper rash, diaper dermatitis, and have to go to the emergency room or present in a healthcare setting more often, we're also seeing that parents are struggling with anxiety and depression if they cannot provide for their children. And so this is really important when we're thinking about health savings. Investing in diaper banks is preventative care in the long term for families and their overall health and well-being. And I'll just say too that the investment over the past 3 years has been incredibly helpful for the ability of diaper banks to reach more families across the community. We see right now that there's such high need in the state, and there's so many diapers that would be needed to get to families that actually need them. And so this is really helping to scale the work that was already happening in a huge way.
That's true. Raziya, can you tell us approximately how many families do you serve per month?
We serve about about 3,500 families across 6 counties on a monthly basis. And
Wow.
we're just like scratching the surface. We're constantly getting partners who wish to work with us in even other counties that we're not even touching yet. We have some counties that kind of don't make up Western New York, but they're really close and it's a gray area. So we're even pulling in access to other counties that are kind of right around and surrounding that space. But I was on a panel yesterday, not to veer too far off of your questioning, but I was on a panel yesterday with food insecurity organizations. And it was just me, representing diapers. And the idea for me is to normalize what it looks like when we think about diaper need as we think about food insecurity. I mean, the mic just passed right over me of people talking about all the ways SNAP benefits are affecting community, but we don't think about the other things that make up basic needs. People don't just need, and I don't wish to ever minimize food or shelter or anything of that nature, but basic hygiene, security, and the respect that you show someone when you make sure that they can also be healthy in that way is very important. And I think we need to normalize that. There's only 18 diaper banks in New York. If there were only 18 food banks and food pantries in New York State, can you imagine where we would be right now? Children would be starving if there was only 18 food or 18, if there were only 18 food banks. And so similarly, just really getting people to understand, to Lacey's point, it's an investment. A parent who is dealing with maternal mental health and paternal mental health, a grandmother who is taking on the charge as a guardian in the household, that is not the only need they have. And the research of National Diaper Bank Network and the work that we do uncovers even more need that comes from that. So you give people food, but if they don't have anywhere to cook it, nowhere to store it, we're not thinking about that. We're not thinking about the gaps that still exist. And I think it's easy when you minimize it to being a diaper. We're giving out free products to people, that you minimize the fact that you're giving somebody a chance at equality and health equity, and you're giving them an opportunity to step up and self-serve themselves in their household. And you're adding some confidence into a space that might have been tested by just the day-to-day circumstances. I think punishing people and kicking them when they're down, I don't ever find that to be an effective method. So even though we know there's other things that go into creating healthy households, let's not negate the very small things that still go a long way, like access to clean, healthy hygiene items, and the work that we do collectively as agencies.
So how does a person contact you? And Lacey, I'll ask you the same thing also. How does someone know where diaper banks are located, and how do you contact diaper bank? Is it like a subscription kind of thing? Do you have to sign up and have you digitized your registry so that you know how pantries are doing now? You just go in and you select what you need, and you come in on that day and collect it. Is that what you do? How do it get to you?
Yes. So I would say that we are constantly working to get to that space where it's completely digitized. And again, I would be remiss not to mention that National Diaper Bank Network is constantly thinking of ways to provide resources like Pantry Soft, like board source access, things that help strengthen us as agencies. When families want to apply for us, they can do it from our website through an online application. We set them up per county so that a family can get right to the county that they're trying to get access to. We provide the supports right to that county, and they're able to give them out. That's bringing people in to understand about other resources available in their county. And then we do good old fashioned walk ins here in Buffalo where they can go to our local community center, Delavan Grider Community Center, and sign up on the spot. So we're trying to take down all of those barriers that may exist. We're also working inside of health clinics, and we're working inside of the school system now. So we're trying to meet people where they are and remove all the barriers to access that have existed up until this point. And we also try to coordinate and collaborate with other agencies that do similar maternal based assistance like doula work, or whether, connect them if they need SNAP or TANF or WIC. So just trying to make sure that we are all working as like a continuum of care for the families that we're serving, because it's not just one thing. Usually there is a set of needs that people have. And so if
Yeah.
we minimize it to just diapers, then we don't think about the fact that this is connected to food, this is connected to shelter. Um, but yeah, the process, every diaper bank makes its own outreach process where it may be tied into a food distribution or it might be once a month. Ours is a pretty steady Monday, Wednesday, Friday from 12 to 4. They can come in and sign up, or they can sign up online and be placed in a wait list situation. Whereas we get access to additional supplies, we take people off the wait list and then put them in the regular rotation of monthly pickup.
And I could share for the diaper banks across the state that, to Roz's point, they all work a little bit differently. Some diaper banks work on a direct service model where they're giving directly to families. Some work on a partner agency model where they're matching diapers with other services like food, and so they'll work with different community resource centers. They'll work with food pantries. They'll work with shelters, and so those diapers are going to those organizations versus individuals, or some work on both models. So they do a combination of the two. And so to find out what your local diaper bank in the state is doing, you can visit our website, the National Diaper Bank Network.org, and we have a member directory. So you can look at all the diaper banks in New York and find the one that's closest to you, and you could figure out how you could sign up for diaper services from them.
So well, thank you both for those answers. What are we telling the people who are not close to a diaper bank and they are in need? What are we telling them to do? How does the service get to them? Because we know in rural communities, there's the transportation divide, there's the digital divide, there's the every divide. So they're not close to the diaper bank because diaper banks are not in every county, every social service district. It's some of them, they may be in your county, but it's not close to where you are. But you need diapers. What are we telling those people?
Well, for us, again, we try to find hubs that will work in the other counties to kind of help cut down on that transportation. And then it really, sometimes it's a case by case. If we reach out to a family, we don't quite have a service area there yet, but we know the need is there. We'll Amazon them some diapers. We'll ship them to them just to solve that immediate need. And then from there, we recognize, okay, we have a little bit higher need in Wyoming County. Let's figure out what that looks like, and let's try to find a more permanent home there so that or hub location there so that we can make sure that we cut down on that. Now, again, 18 diaper banks, entire state of New York. There's clearly some gaps there, but I think I can safely say that most of the diaper banks are trying to handle a region versus one concentrated area so that we can support families, even if they're not in a transportation friendly area for us.
You said something. I'll get to you one second, Lacey, because you just said something that you will ship it to someone. How do you recoup the costs of doing that?
Sometimes we don't, to be quite honest with you. I will say that every bottom covered, and I'm very grateful for this. We have been able to get unrestricted funding in a lot of areas, even so much as the funding that we come to New York State to lobby and advocate for. A lot of that funding, we can then design the budget that associates the funding, so we can route money into shipping dollars, into supply dollars, and so that's how we get it back. But depending on what the situation is, sometimes we just may not get it back in an immediate way. And it just goes to show the need. And so it works for the impact piece of it, but we may not get that money directly back to us. So it kind of varies, to be quite honest with you. But when a mother's there or a father's there or a grandmother just got custody exactly of her children due to some emergency situation, that's really not the time to be saying, well, contact your legislators and have this conversation about the importance
I would
of
hope
funding
not.
us. Right. And then let us know how that goes, and we'll make sure we, hope to get to you in 3 to 6 months. So I think it's just on a case by case basis. But I know for us, we also still want to have systems in place so that you're not doing a ton of one-off work. So it just, for us, we'll just open that conversation about figuring out how to be more present in those communities and counties.
Okay. Lacey?
Yeah, I just wanted to mention too that you might not have a diaper bank where you live, but there might be other organizations that are popping up that are just beginning, or they might have a little bit of diapers that they can spare. And so you could also utilize 211 as an opportunity to see if there's any new organizations that might not be yet a diaper bank, but are starting an organization or have some diapers because they received them through some means. And so I think there are still, ways to get diapers, even if you don't necessarily have a diaper bank yet. But also just want to mention that, Roz, your point about the shipping of diapers too, I think it identifies something that, is an opportunity for corporate partnerships or services to be provided to diaper banks, by the Amazons, or even the DoorDash we've seen has delivered car seats to families in the past. And so there's definitely opportunities to be explored too. And it really, emphasizes the point that in order to end diaper need, it's going to take the work that's happening on the ground. It's going to take government investment, but also we need a lot of philanthropic support and support from others that are, have some deeper pockets to really help invest in this issue and make sure that families are getting what they need when they need it.
That is so true. So, Raziya, do you do private fundraising? How do you do that?
We do. Yes. So we're again, I'm very blessed that the work and the integrity of the work really lends us opportunities that the community sees what we're doing and they want to figure out how they can get involved. So we have a lot of corporation support. Right now we have volunteers here at the warehouse as we speak. And so they come and they see and they realize, I didn't have this understanding of diaper need. Let me see how I can maybe pull in my church, pull in my sorority, bring in my department or another affinity group at my corporation that I'm involved in, and they'll raise funds on behalf of us and give those to us. And that helps to offset our costs significantly. But we do private fundraisers, not as many as we don't have like a development director or anything like that. We're just doing good old fashioned handshake, networking opportunities. I'm an introvert, but I get out there when I have to and just make relationships so that people know, like I'm in your face with this. If you know me, I'm called the diaper lady in my community because everywhere I am, I'm talking about how diaper need is affecting somebody else. And I really want to normalize it. And then people will go where they feel like their money will go the furthest, to be quite honest with you. And they see what we're doing. And we leave the doors open. They can always come and understand what we're doing. And we're working for Western New York and for Buffalo. And so when we go places like Albany or to DC, I think it also bodes well for us as an agency locally when we come back, because they know we're not just leaving it just here in Buffalo. We're asking for government to step up. We're asking for leaders to normalize this in the funding. We want to know that you care enough that people don't have to suffer. I mean, because I have to live in this community. So I want to see it be the best it can be because I still have to come home here. You know, I'm Buffalo born and bred. I can see how our community has gone down when funding priorities shift, when certain things aren't properly funded. And so it's just getting the word out and fundraising and then leaning on the resources that NDBN is taking the time to do this research, to get this information for us. And they do a great job of keeping us abreast on everything that's happening in the landscape of legislation so that we can be best prepared to give the discussion when the time comes.
So this has been an interesting conversation. I think, people do not realize the need that's out there. Because they hear us, they're like, eh. And so we hosted, I think last year, we started doing that. Was that last year? We were doing our pre-Mother's Day giveaway. We do the Mother's Day event where you're doing clothing, et cetera, et cetera. And we decided to ask one of the diaper banks to assist us with getting some diapers. And you would not believe the amount of people who came and just wanted diapers. It's unbelievable. And, I always remember this young man came and he says he wanted to take some home for his wife. She was pregnant. I'm like, yeah. And he says, oh my God, you don't understand how far this will go in helping us. And then we had some left over. So we gave him, we had some left over. We were doing a food distribution. And we decided, let's take some of these diapers outside and see what will happen. And again, I don't know how the word gets around that there were some diapers there, but people just kept coming just for the diapers that we had. And so we realized that we have got to continue asking people, wherever in whatever space you're hosting something. These are things that we must have for the community. And so we see now that students are saying, oh, they're going to do collections so that they can have, a few diapers at their school pantries. They can have some period products at their school pantries. This all ties in. It's all in, ensuring that we're meeting the needs of families. Because it's not giving a diaper for one child is not just helping that child, is uplifting an entire family. I think that's what we have to remember when people are asking for funding or when people are saying, why are you spending so much money on social services? It's about uplifting families. And we have to remember that. That's all it's bottom line. What is it that we're doing to uplift those families that are in our communities? Because when we uplift families, we are uplifting the entire community. Right? We're lifting people out of poverty. We're improving health outcomes, everything. And just that the paradigm shifts because of the things that we are doing. And so I want to thank both of you for everything that you're doing. Everything. I know I'm probably going to see you again, until our budget is done and then we get that money. And, we're trying to make sure that piece of legislation gets enacted so that we can offer those families that quarterly assistance. Because in New York, we said, okay, we'll do it quarterly. Because, we started saying we'll cover monthly, then, the pushback. Say, okay, quarterly, $80 per quarter to a family per child, right? And so they can have up to age 3, the assistance in purchasing diapers and just diapers that they can use and that they need. So any last words each of you wants to tell everyone as to the importance of assisting when it comes to diapers? We'll start with Lacey.
I just want to say thank you, Senator Persaud, for your decade of leadership on this issue in New York State and for all of your tireless advocacy, because the investment in diaper banks in New York State, as I mentioned, has been tremendously helpful for ensuring that we're working towards filling those gaps across the state, and we'll continue to do that. So thank you so much for your leadership.
Well, thank you for always being there, not only with diapers, with period products too. We'll have another conversation about that. Raziya?
I echo everything Lacey said. I think it is very important that you use your voice for good. And so thank you for advocating for this. And I will ensure that we start helping spread that word equally as loud, because I have not met anybody who is opposed to a little extra in their check to get, to go a little further and do a little more. And I think normalize proper distribution of assets so that we can have, safe and healthy outcomes. It's not, to your point, it's not difficult. It's, just sweep a little bit this way, to do the work that needs to be done to make sure that that pays in dividends. Families can go and do a lot more if we just invest in them and believe in them. I think it is a vote of confidence when a family knows that they're being invested in. And I think you work a little harder when you have that little push behind you. So thank you for your work. I will stand alongside you in any way that I can. And I appreciate you.
Tell everyone how they can get in touch with you if they need to find you.
Yes, well, everybottomcovered.org. We're located in and servicing Buffalo and Western New York. And please go to our website, find out how you can help, and go to National Diaper Bank Network if you're anywhere else in the state, and find out the other 17 agencies that are doing really amazing work across the state. And I hope that we can continue to do so.
Well, thank you both. And I want everyone to understand that you're not only offering diapers, you're offering a lot more. You're offering a lot more. You're giving people a hand up, and everything that you're doing. I appreciate everything that you do, and I will see you around Albany, when we're fighting for that money, so that again, every bottom can be covered and every diaper bank can be funded. So thank you both for being with us today, and I will see you around.
All right.
Take care.
Have a great one. Thank you.
Bye.